Doc, well, first of all, I have to apologize. I'm going to ask you something that would be very, very basic for doctors. Pero I suppose it's a question that's on everybody's mind now na merong dalawang nabakunahan na ng, I think, Pfizer and Sinopharm, both doses already completed, pero nag-positive pa rin with COVID-19 and they, I think, are both based in Cebu. Now, ang tanong ko po sa inyo, what exactly should a vaccine give us ba? Will it will it prevent infection, prevent transmission, or will it just prevent serious symptoms? What should we really expect from a vaccine and what shouldn't we expect from a vaccine?
Okay, these vaccines needed clinical trials to prove their efficacy and safety. Now, in the clinical trials for these vaccines, it's not finished yet. It's being continued, but they were already given what we call the emergency use authorization.
Opo.
Now, the original clinical trial, which is still ongoing, will show us if it actually protects against infection. But because it was an emergency use authorization, what we know from the early release of the results, the interim release of the results, and this was actually reviewed by independent review panels, including the WHO, it showed that it protects against severe disease, severe COVID-19
Severe disease.
and prevents hospitalization.
Okay.
So what we can expect is that people can still get sick, get infected, but there will be no hospitalizations or there will be no severe COVID-19. And it also depends the timing of the vaccine when it was given. For example, you needed to complete 2 doses if you want to increase your protection against possible infection. But what we said again and again and repeatedly, it protects against severe illness, not necessarily infection. That's why the recommendations, even if you get vaccinated, you may still get exposed. You have to wear your mask. You have to practice or observe social distancing, wash your hands, and the minimum health standards should be maintained.
Just so that everybody has realistic expectations. So the vaccines, as we know them, they will not prevent infection. They will only prevent serious symptoms. Tama ho ba?
It can prevent infection. We don't know how many can be prevented with infection because the clinical trial is still ongoing. But what we certainly know is that it will definitely prevent against severe COVID-19 or anyone getting hospitalized. So that's what we're certain about. What we're not certain about if it's going to prevent infection for many people. But now we have reported that those who have received the vaccine, they had infections, whether they were asymptomatic or where they had a mild illness, but this did not get
Severe,
worse.
yeah.
This is not become any severe illness or something that prompted these patients who got vaccinated to be hospitalized, remain in the ICU, or has a very bad outcome. No, we don't have that.
And I suppose we have to be careful about the numbers that we bandy around. I mean, especially the media, kasi we've been talking about 94%, 95% efficacy. This apparently refers only to efficacy against severe symptoms.
That's correct. And I think we should be very careful. We should look back on what has been reported. Sinovac, for example, when they look at the overall efficacy of 50%,
50%.
so this raised to the eyebrows. But what they did not report is that it's 100% effective against severe illness.